All right, we are waiting for people to get on, and we're going to get the PowerPoint ready. While we wait for people to get on, let's see. Okay, thank you for joining us for this webinar, 10 Resolutions for Better Breast Health. And the idea here is to give you some ideas that would be easy to fit into your New Year's resolutions, things that might be very simple changes that you can make that could pay big dividends as far as your health goes and your breast health in particular. So just to give you a little of information of who I am, make sure that I can get this thing to advance. Why aren't we? All right, hold on one second. Okay, there we go. We're all set. Slides were not advancing. My name is Dr. Chip Gilmore. I'm a naturopathic doctor in Louisville, Kentucky, and I have been operating a thermography center for 6 years and open for naturopathy for the last year and a half. And today I'm going to be giving you some of the ideas that we give to our clients to help them when they have breast health issues. So if you would like more information, here's a couple of websites that you can look at. www.brosthermography.com. That's our franchise website for the thermography company. And we do present information useful to our clients at our Facebook page, which is just facebook.com/Bras Louisville. So you can get more information on the topics presented today if you go to either one of those sites. So what we want to do today is focus on breast health. So there's a lot of information, breast cancer awareness, which is focused on breast disease. So today we're going to focus on breast health and give you some ideas that you can very easily add one or two of these today. And the more the merrier. So let's get started with 10 resolutions for breast health. Some of you may have heard of Dr. Christine Horner. She's written some books on health, including breast health. She used to be a surgeon doing plastic surgery for those that had had mastectomy. She was a member of the American Cancer Society and a spokesperson for them. But she has kind of become a whistleblower to kind of help inform people that there are preventable causes of breast cancer. And in her book, she says, when we do one prevention idea, we decrease our breast cancer risk by 30 to 40%. And I believe the idea that she had in mind there was to optimize your vitamin D levels. But she goes on to say that when we do more than one, the prevention increases astronomically. So there's a lot that we can do as far as enjoying overall breast health and prevention. This is a quote from Dr. Mercola. If you haven't heard of him, there's his website, mercola.com. Probably the most popular natural health proponent on the internet. But he says, in the largest review of research into lifestyle and breast cancer, the American Institute of Cancer Research estimated that about 40% of U.S. breast cancer cases could be prevented if people make wiser lifestyle choices. And then he goes on to say, I believe these estimates are seriously low, and it is more likely that 75 to 90% of breast cancers could be avoided. So some encouragement there to really take this seriously. This slide says drugs should be a last resort. And I just give one example of how drugs can be promoted even though they may provide very little benefit. And then when you weigh the side effects, there's often no benefit. This says evidence from the cholesterol-lowering drug trial known as CARE. cholesterol and recurrent events showed that Pravachol, a cholesterol-lowering drug made by Bristol Myers, reduced the chance of suffering from a heart attack by an absolute reduction rate of 1.1%. So not that much of a benefit. This minuscule benefit, it goes on to say, was accompanied by a 1,500% increase in breast cancer among women taking Pravachol. There's your side effect. An increase in cancer rates among Pravachol users is also shown in the drug trial known as PROSPER. So, encourage you to practice some of these ideas we're going to be giving you today for breast health, and hopefully drugs are our last choice. So the first tip of the 10 is to practice early detection. And I'm going to be sharing with you a little bit about thermography, but this is one of the 7 essential steps listed by Dr. Veronique de Saulnier, otherwise affectionately known as Dr. V, in her book, Heal Breast Cancer Naturally. She talks about breast thermograms as early detection, and that is something that we offer here in our Louisville practice. And to give you some idea of the cost of a thermogram, a breast thermogram costs $195, upper body thermogram is $295, and a full body thermogram is $395. So hopefully within range of most people's budgets. And you can use your health savings and flex spending accounts for thermography. But here are a few highlights about thermography if you're not sure what that is. It's a safe, easy, and pain-free imaging that can be used for the entire body, but a lot of women use it for breast health. There's absolutely no radiation exposure. It is important to lower your exposure to radiation, minimize that, because ionizing radiation, such as you find with a mammogram, is a known cause of cancer. So I'm not saying you should never have a mammogram, but you definitely want to lower your exposure. No compression of the breast tissue with thermography. The entire breast can be imaged. It's the only imaging I know of where you can actually get a picture of your lymphatics, what they look like, and their overall health. Provide a picture of fibrocystic breast disease. And hold on one second, I'm getting a little feedback, so I'm going to go ahead and mute everyone. And then at the end here, if you have any questions, I'll unmute everybody and we can go from there. All right, so back to our show. Thermography is useful for evaluating the chest wall after breast surgery. I had a client today that said they would not do any type of mammogram for someone that had had a mastectomy. It's effective for breasts of all sizes, effective for implants, and it is interpreted by medical doctors. So a lot of people want to know what do medical doctors think about thermography, and it just depends on what they've been told. Some people have been given very negative information, but obviously the medical doctors that read and interpret these have a different view and a very favorable opinion of what thermography can do. So why bring this up? Well, what you're looking at here is a cancer cell growth chart. And if you look at it, you can see that it takes 8 years for a breast cancer to reach the size of a little more than 4 billion cells. That is the size that a breast cancer must get to that size, 4 billion cells. It's been growing for 8 years before a mammogram can detect it. So a lot of people think that early detection means something's been there for weeks or months or maybe a few years, but the reality is it's been there 8 to 10 years growing before a mammogram can detect it. And then where this red arrow comes in, and that is showing at the 4-year mark, rather than the 8-year mark for the mammogram, thermography is able to detect inflammation, thermal abnormalities 4 years earlier than a mammogram can pick it up. And that is one benefit to something that's not waiting for a lump to develop, but is looking at thermal patterns. Mammography can only detect cancer once the tumor is developed to a measurable size. This is from the Journal of Surgical Oncology. And a breast cancer growth has 4 to 10 billion cells before a mammogram can detect it. So again, that's from a major medical journal, the Journal of Surgical Oncology, letting you know that that's how long it takes before a mammogram can detect it. So the next question about thermography would be, does it work? And I've just included one study as an example. This one was done by Spitalier and Associates, and they used thermography to screen 61,000 women over a 10-year period. And they found that 91% of non-palpable, that's cancers that could not be detected by touch, were detected by infrared imaging, and that of all the patients with cancer, thermography was the first indicator of the disease in 60% of the cases. So that's a pretty good benefit to the thermography. So now what I'm going to do is just quickly show you some imaging of thermography and some of the different types of things that it can detect. So what this slide is showing, on the left you have healthy breasts, and then on the right you have breasts that are at high risk. You're actually looking at the red there is inflammation, and it's got that honeycomb pattern, which would indicate most likely fibrocystic breast disease. But fibrocystic breast disease does put you at higher risk for breast cancer. This slide shows male and female breast cancer, and the one on the left of the male shows something else that thermography can detect, and that is angiogenesis. So we know that tumors will develop new blood vessels to feed themselves, and these will show up on many times on a thermogram. So that's one thing, one method of detection that thermography uses. Inflammatory breast cancer, it accounts for up to 6% of all cancers, all breast cancers, but it's undetected by a mammogram because it does not develop into a lump. It spreads in sheets across the breast, and usually it's detected late because it is not picked up by mammograms. But as you can see from the image, a thermogram will pick this up. Lymph node problems. So in this image, you're looking at the side image of a woman with some very significant inflammation in her lymph nodes under her arms, extending from her armpit all the way down to her waistline. So that none of that inflammation, that red, should be there. Dental health. Around the mouth here, thermography is excellent for looking at overall dental health. You're looking at inflammation around the mouth with drainage down into the lymphatic system. And there is a doctor named Fred Hughes who's written a book. I believe the name of the book is Am I Dead or Do I Just Feel Like It? And in that book, he says there's an ironclad link between dental health and breast health and also heart health. So important thing to know, especially if you've had a root canal, if there are issues growing subclinically where you have toxins entering the bloodstream from that area. Estrogen dominance is something that can be visualized with thermography, so hormone imbalance. This is a slide on the left showing a woman that is red, has red and inflammation everywhere on her thermogram. And the next slide shows an image that was taken just 10 days later with probably an 80% reduction in that inflammation. The only dietary change that she made, in fact, the only change she made whatsoever, was that she eliminated Diet Coke from her diet. So even though we are told that aspartame is safe, for this woman at least, that's not true. It's creating systemic inflammation. And I would agree that it's not safe. So we'll get into that a little bit more later, but thyroid can be visualized. A lot of times people are given a test and they're within the range of normal limits, but they have all the symptoms of hypothyroid. And thermography is something that can help visualize when the thyroid is dysfunctioning. Coronary artery disease, that blue that you see over the heart, that cool area. The blocking inflammation in the carotid artery. The immune system dysfunction, this blue that you see over T2 in the spinal column, is often associated with some type of autoimmune disorder. Arthritis can be visualized. Deep vein thrombosis, pick that up very well, and excellent for monitoring diabetes. So just a few of the different things that thermography can pick up, TMJ, a variety of different things. So that's number one, is practice early detection with thermography. Number two is fluffier girls. So there's a quote there on the right from Linda Bamber, who's a naturopathic doctor. And when she began to practice very particular breast massage techniques, she says she had medically documented fibrocystic breast disease. The doctors knew where the lumps were. She got her lumps to disappear literally overnight. And there were a couple things, one supplement, I'll tell you that in just a second, but she practiced that with these particular massage techniques. Her mother had had radiation from breast cancer, and she said that her breasts were hard as rocks. And within 1 month's time, they were able to get her breast back to normal through the use of these breast massage techniques. So a couple of benefits to fluffing your girls' breast massage is to move toxins continuously through the veins and lymph system. It can be done in just a few minutes at a time. You begin with 30 minutes of massage daily for about a month, and then continue once or twice weekly, kind of a maintenance phase for about 10 to 15 minutes once or twice a week. It's important also to use a natural, healthy carrier oil mixed with essential oils. So something like a natural almond oil or something like that, to mix essential oils and use that as your massage oil. And what I have on the next slide here is Healthy Girls Breast Oil. That is what we sell out of our office here in Louisville. And that's a good product, has a good healthy carrier oil, and I think at least 6, maybe more different essential oils that are known to be, some of them, if you've seen the documentary, The Truth About Cancer, some of these are known to have anti-cancer properties. Frankincense, orange, rose, just a variety of really good essential oils there. And by the way, if you're interested, you can go to a website, Aromatherapy Nature's Way. You can order from there. And Joyce, the owner of Aromatherapy Nature's Way and the maker of Healthy Girls Breast Oil, also has a video showing how to do the breast massage techniques. So you can go to my Facebook page, which is facebook.com/Bras Louisville. And I posted just today a link on how to do these breast massage techniques, and you'll see Joyce there actually doing the video. It takes just about 5 minutes to watch it. Number 3, burn your bra. So back in the 60s, this was kind of a thing, but it turns out they were actually lowering their risk of breast cancer, at least according to Sydney Singer, who's a medical anthropologist. And they wrote a book published in 1995 called Dressed to Kill. And they surveyed, the premise behind the book was that they surveyed 4,700 women in Fuji. Half the women wore bras and half went without. And although both groups had the same living environment and diet, the women who wore their bras had the same breast cancer rate as American women. And there was almost no breast cancer in Fuji women who did not wear bras. So in their study, they found women who wore their bra 24 hours a day had a 3 out of 4 chance in developing breast cancer. Women who wore their bra more than 12 hours per day had a 1 out of 7 risk. Women who wore their bra less than 12 hours per day had a 1 out of 152 risk. And women who wore bras rarely or never had a 1 out of 168 chance of getting cancer, which is the same rate as men. So why would a bra make a difference? Well, one reason is that the bra strap is cutting into your lymphatic system. You have a lot of lymph under the armpit, and the circulation for that gets cut off. And in our thermograms, we can actually see the inflammation from the bra strap going right from the breast area and wrapping all the way around to the back, to the woman's back. So you want to find some way to eliminate wearing a bra as much as possible. Switch to wearing a camisole. And if you'd like information, I can get you in touch with a lady that sells a line of clothing called Ruby Ribbon. And that is a line of clothing that is supportive, that also helps women to get rid of their bra. Number 4, use a natural deodorant. So again, we're looking at this image of the woman that has the inflammation in her lymphatics from the side, inflammation stretching from her armpit all the way down to her waist. And this woman was applying antiperspirants 3 times daily. So again, at the very least, antiperspirants are clogging your pores, but in addition, you're probably getting toxins directly into the bloodstream, being absorbed through the skin. So I would recommend using some type of a natural deodorant. We have one that we make in our office. You can find the recipe for natural deodorant online. We use a coconut oil base, cornstarch, essential oils, and very effective. It's one of actually our most popular products. So use a natural deodorant. Don't get that aluminum from the antiperspirants in there clogging your pores. Number 5, supplement, especially with iodine. Now, iodine is very important to your breast health. But here in America, most people are iodine deficient. In fact, the Japanese get 100 times more iodine in their diet than Americans do. But one of the reasons we have so much thyroid, so many thyroid problems in this country, as well as breast problems, is because we are iodine deficient. Dr. Sherry Tenpenny is quoted as saying, iodine deficiency is also being implicated in fibrocystic breast disease. And by the way, that iodine supplementing, iodine loading is the supplement that Linda Bamber used when she got rid of her fibrocystic breast disease. It's being implicated in fibrocystic breast disease that can lead to breast cancer and polycystic ovary disease. Through an FDA-approved study to measure iodine use for the treatment of breast cancer, it was found that breast cancer went away when animals with breast cancer were treated with iodine. Iodine supplementation enables excess cells to be cleared out, and the breast can return to its normal resting state as the fibrocystic disease slowly disappears from the breast. All right, number 6 on our list of New Year's resolutions for breast health is to eliminate toxins. So a couple things on this. Number 1 is you want to make sure that you are eliminating toxins, and number 2 is reducing your exposure to toxins. So let's talk first about eliminating toxins. You have 5 avenues of elimination that your body uses. So you can remember the acronym BULLS, B-U-L-L-S, and that stands for bowels, urinary, lung, lymph, and skin. 5 ways that we get rid of toxins. So first suggestion is keep your bowels moving. If you're not having a good soft bowel movement, not diarrhea, but you don't want it to be hard, you shouldn't have to push. You should be doing that at least once a day. But some people are still constipated even if they're having 1 bowel movement a day. So preferably 2, maybe even 3 bowel movements a day. Keep the toxins moving. Second, urine. Make sure that you hydrate well, and that you should be drinking half your body weight in ounces of clean, pure water daily. Keeping the kidneys moving, toxins being pushed out through the kidneys. And make sure that this is one of the easiest things to fix a number of health issues, by the way. So make sure you're drinking half your body weight in ounces. I personally prefer distilled water. There's some controversy out there by that, but really I find I'm following the advice of a mathematician who looked at it very scientifically and helped tens of thousands of people heal just about everything you can imagine. His name is Dr. Kerry Reams, and he recommended drinking distilled water. And so that's what I drink. You can get a distiller off Amazon for about 90 bucks, and makes about 1.5 gallons every few hours. Another thing as far as eliminating is to keep your lymph moving. And here, in addition to the breast massage, I would recommend dry brushing. You can find videos on YouTube. You can also, put links to dry brushing on our Facebook page. You can go on there and find out exactly how to do this. But you do it 7 to 10 minutes before a bath, and it's the equivalent of a 5-minute walk or a 5-mile walk for your lymph nodes as far as moving toxins through the lymphatic system. You do it dry. You don't use any lotions, and do it before your shower. So something that's very easy to do and has produced really good results for a lot of people. Clear your lungs. You want to avoid breathing in environmental toxins. So where are we getting those? Well, obviously we can't avoid walking outside where we're going to get some exposure, but really in our homes, having a good air purifier is very helpful. Making sure you change out your furnace filter. But more than that, making sure that you're not using cleaners that are highly toxic. There also are some alternatives. I'll give you one in just a second. But make sure you're not really just regularly breathing in toxins, things like bleach and the like. So let's talk about environmental toxins. There are 73 chemicals in consumer products and foods that are tied to breast cancer. Again, things we clean our house with, things we're putting on our body. We need to be using natural things. There are 47 drugs that cause breast cancer. We already talked about one. Pravachol increases breast cancer risk by 1,500%. 18 dyes and 10 pesticides cause mammary cancer. So these are things in our processed foods, things sprayed on our food, like Roundup. I just posted about a 5-minute video on my Facebook page. Would encourage you to look at, talking about some of the risks of glyphosate, which is in Roundup. And that's starting to show up in things like Cheerios, which is one of the first things we start feeding our babies. So good to know that these things are out there and that we can make better choices. Number 17, there are 17 hormones increase the risk 20 to 30%, especially our younger generation that is on the pill. That is a hormone disruptor. It uses hormones to prevent pregnancy. So it increases the risk of breast cancer 20 to 30%. And you're probably not going to hear that very much out there in the culture, but that is the reality. Estrogen dominance is a problem. We just talked about, artificial hormones that can cause issues. That last slide was looking at heavy increased vascularization due to estrogen dominance. Another way to reduce your excess estrogen is to avoid plastics. So xenoestrogens from chemicals and especially plastics leach into our food and mimic estrogen. One Dartmouth University study showed that plastic wrap heated in a microwave oven with vegetable oil had 500,000 times the minimum amount of xenoestrogens, that's foreign estrogens that come from outside the body, needed to stimulate breast cancer cells to grow in the test tube. So we do not want to drink out of plastic bottles as much as possible, use glass. And then one idea as far as avoiding toxic cleaners, when my son was a year and a half, he's 15 now, we went through a process of healing his body. He was covered at 80% of his body was covered with eczema, and he had severe allergies to everything. And part of his healing process, it was a 2-year process, but part of that was removing toxins from our home. We began shopping at an online wellness store with over 500 products called Melaleuca. And if you would be interested in that, my wife promotes Melaleuca now, and she does webinars in the evenings. Feel free to private message me if you would like more information about how to get toxins out of your laundry soap, your shampoo, your household cleaners. Basically, Melaleuca is whole food products at Walmart prices. So very good company to know about. Another form of toxic exposure that most people don't think about is electromagnetic frequencies, and this is what we're getting from our cell phones. The United Nations Health Agency, the World Health Organization, now lists mobile phone use in the same carcinogenic hazard category as lead, engine exhaust, and chloroform. Numerous studies indicate prolonged cell phone use is hazardous. So I would just say use your speakerphone, keep that away from your head. Whatever you do, please don't put your cell phone in your bra. You can go on YouTube and look up cell phones and breast cancer, and you'll find a video there of a woman that has a breast cancer in the shape of a cell phone. Number 7 is adjust well. So I really would encourage you, if you haven't used a chiropractor, to use chiropractic. In this slide, the image on the left, the man has inflammation covering probably over 90% of his back. We took this image, he went up, had a chiropractic adjustment, and 10 minutes later, we took the second image, which shows a 80% reduction in inflammation in this man's back, probably more than 80%. So I have seen a number of people benefit tremendously from chiropractic, not just from pain, but just from making sure you don't have any blockage in nerve flow to your breast, to your digestive tract, reproductive organs, and the like. So highly recommend that. Number 8 is to recognize and remove what I call spiritual roots of disease. I'm going to reference Dr. V again, her book, Heal Breast Cancer Naturally. She calls these emotional toxins. Again, Dr. V has had breast cancer and healed herself of it twice, and has helped over 5,000 women do the same thing. But one of her 7 steps to healing breast cancer naturally is to deal with emotional toxins. Now, we all understand the idea that if we're constantly anxious, our thoughts affect our emotions, so we're living with fear, anxiety, and stress, and that in turn affects our adrenals, affects our stomach. You can get an ulcer. And I'm going to give you several different spiritual roots, and also a website that you can go to look into for more information. But take inventory of whether or not some of these things are active in your life. Number 1 is accusation. That's when constant thoughts just accusing other people. Number 2 would be bitterness from some of the things done maybe in your childhood or at any point in your life, but unresolved bitterness, resentment, unforgiveness. Number 3 is envy and jealousy, whether that's envy and jealousy of someone else's possessions, their relationships, their body image, whatever it is, can cause health issues. Already talked about fear, anxiety, and stress, rejection, self-pity, unclean, unloving spirit. This would be someone who doesn't love themselves. So if your thoughts are constantly beating yourself up, I have seen that linked to autoimmune disorders where the body starts to attack itself and it comes into agreement with the mind. But this would be self-hatred, self-bitterness, self-resentment, unforgiveness towards yourself. So definitely need to deal with that. And the last one would be unresolved. I'm sorry, second to last. Number 8 is guilt and shame, unresolved. Happy to help you with that if you need some just issues getting past your past. And number 9 is occult experiences that I've seen really cause serious emotional and physical issues with people. The website that I mentioned is called beinhealth.com. That's BEIN health.com. Excellent website for looking into how to remove spiritual roots. I have personally seen people heal instantly of things like depression, eating disorders. One lady that came into my office had Sjogren's. Within 5 days, she was completely healed by dealing with spiritual issues. So don't underestimate that. Number 9 is one that I think we probably all think of, and that is eat well. And so I would just encourage you to, number 1, reduce white sugar. That's cancer's favorite food. And other dead foods, processed foods, and just begin working to add more raw organic fruits and vegetables into your life. If you would like some ideas on how to do that more easily, I do recommend a company called Isogenics. They make shake-based products that are non-toxic. They're sweetened with stevia, which is a plant-based sweetener. They use whey protein, and you can get whey or you can get plant-based, but the whey is made from grass-fed cows, so non-toxic, no hormones, no antibiotics, an excellent product. But ideally, you should be reducing white sugar. Introduce sweeteners that are more natural, like honey, raw maple syrup, pure maple syrup, and also blackstrap molasses, which is excellent for iron, B vitamins. They just have a number of benefits. So begin working sugar out of your life. If you want some ideas for things that can help you control cravings, as a naturopath, there's a diet I put people on called a ketogenic diet. Excellent for controlling blood sugar levels, and you would be shocked at how it eliminates craving. Another thing, especially for breast health, is just to reduce or eliminate caffeine, especially if you're starting to get some fibrocystic issues, pain and tenderness in the breast. Try something very easy. Wean yourself off of caffeine. I wouldn't go off of it overnight. You're going to have a bad migraine the next day, but start weaning yourself off of that. Try a coffee substitute called Teeccino, Teeccino, and you brew it just like coffee. Tastes pretty close, and you'll get used to it. It's actually alkalizing to your body, and no caffeine in that product. One last thing as far as eating, and that is a lot of people feel that soy, like going to tofu, is a good substitute. I would disagree. Soy mimics estrogen as well. It's not a health food. What's more, 89% of soy is genetically modified. And genetically modified foods contain things, especially high doses of Roundup, not to mention genetics that our body don't recognize. So use soy, get non-GMO soy if you can find it, but use it as a condiment, not as a staple. So I would avoid soy milk. Don't give that to your kids. I would prefer almond milk. We actually drink raw milk. Believe it or not, it's actually a natural health food. So soy is not a health food. Eat organic as much as possible. And then lastly, number 10 resolutions that you can do is make a commitment to rest well. And just a couple ideas here. One is go to bed on time. Just start getting into the habit of going to bed before midnight. So a lot of people stay up really late. They're getting up early. They're not getting enough sleep. And that really does take a toll on your health. So try to get in bed around 10 o'clock. Some of the best sleep, according to studies, is between 10 o'clock and 2 a.m. And if you have difficulty going to sleep, try drinking some herbal teas like chamomile. Turn off the television at 6, 7, 8 o'clock. And don't be staring at a computer screen. That blue light can impact your ability to fall asleep. And then lastly, take a Sabbath. Studies have shown that we are wired to need rest every 7 days. So that's really important, especially in America. We don't tend to rest. We're constantly going and doing, and would definitely encourage you to have a day of rest at least once a week, where you can really decompress, rest, take time to eat well, be with friends, and just really make sure you have it one day a week at least to relax. So that is the end of my presentation. I'm going to go ahead and unmute everyone. So if you have any questions, you can ask those now. So feel free to go ahead and ask your questions. Getting some funky old feedback there. Any questions you guys have? All right. Well, feel free to email me. My email address is broslouisville@att.net. I'd encourage you to check out our webpage, brosthermography.com. And I put updated information on different breast health ideas on our Facebook page, which is facebook.com/broslouisville. So thanks for being on the webinar today. I hope you have listened to some things, and you can make some resolutions to focus on breast health. Pick one or two things that you can put into practice, or if you're just full of energy, start doing all 10. So again, thanks for being on, and we will talk to you later.